Health Tech Academy's webinar. Hello, everybody. Let's give a minute to everybody who's about to join the program. Welcome, everybody. We're really excited for you all to be a part of this webinar. Hopefully, this session, we will try to make it as informative as possible for all of you. Right. I can see a number of attendees just rolling in right now. Welcome, everybody. So, yes, let's officially now get started. Hello and welcome to Health Tech Academy's webinar. It's going to be our allied healthcare webinar. We basically are going to go and cover the entire process of the webinar, going over all of the details that you will hear about shortly from me. My name is Ian Fuller. I'm one of the leaders in the admissions department, which basically means that whenever a student such as yourself puts in an inquiry, it is me or one of my team members who basically reaches back out to you, answers all of your questions, caters to any difficulties you're facing, talks to you about the program details as well as the enrollment steps. Uh, at HTA, we're basically very passionate about helping all of you, the students, achieve their goals in the allied healthcare sector and basically creating the next generation of allied healthcare workers. For most of this webinar, I will be sharing my screen with you and going over the presentation we have prepared. So just give me one moment while I'm able to set that up. Hopefully you all should be able to look at my screen right about now. So yes, let's start. So please, before we get started, I would request all of you to familiarize yourselves with Zoom. I'm sure most of you, since you're here, have a basic understanding of how that works. But there's going to be a question and answer tab right there, which I encourage all of you to look at and just drop in a hi, so I know you guys are all there. And you will also be, you can ask any questions you have about anything of the panelists, pardon me, about the webinar. And I'll try to cover the question and answer session right at the end of it. But obviously, you type it in whenever you see fit so that in case you don't forget, right? So, a high level introduction for Health Tech Academy. We are based out of Austin, Texas, and we have a cumulative 25 plus years of experience in the edtech field. That is for all of our members combined, and 15 plus years of experience in the healthcare sector for all of our team members. We currently have over 20 coaches, and each coming in with 10 plus years of experience who basically help our students out on a one-to-one basis. Currently on the platform, we have I would say 2,200 plus students, and we're bringing in roughly 150 to 200 students per month into this number, right? Yeah. We've covered the question answers, and right, a really important thing that you all should know about, we will be discussing the tuition deals and discounts for all of you right at the end of the webinar, so do stick around for that. Let's now move on over to the table of contents. Uh, Over the next hour or a little less, we will be going over just at the basis of Health Tech Academy, what we do, what we're all about, how the programs work, who our partners are, so you'll get a good understanding of what Health Tech Academy does, the future of allied healthcare as we see it at Health Tech Academy, as well as we will be spending a lot of our times going over our programs. So we'll go over each of these in details. Some information might be repetitive, so I'll try and speed things along over there, but most of that is going to be definitely very valuable for all of you. We'll cover the admissions process. That is basically my forte. And we will also be going over the financing options, the career services that we have. We'll listen to some testimonials right at the end, after which we will take the Q&A sessions right at the end. So let's talk about who we are and what we do. Um, Just give me one moment to align myself. Right. So we are a leader and in flexible and accessible training for the past 20 years. We are building programs in the allied healthcare space. And we started off with three programs, and currently we do have about 19 programs live on our website right now for everybody to take advantage of. Headquartered in Austin, and basically we pride ourselves that all of our education is completely online, 100% self-paced, and it's basically we've tried to tailor it according to each individual student because everybody is coming in from different backgrounds, from different walks of life, and our goal and our objective with this program is to try and facilitate the most amount of students. And so we've kept the program as friendly to each and every one of you guys as possible. Right here, you can read our vision statement as well as our mission statement, where basically we're aspiring to transform and innovate the way healthcare professionals are educated, hired, and retained. And our mission statement is right there at the bottom, where you can, go over that. Take the 10 seconds to read while I have a sip of water. How our boot camps basically are going to work is that we work with industry experts in the field. We work with universities, employers, healthcare partners to create the most up to date and state of the art programs that are industry aligned, that will get you job ready. And after taking any of these courses that we have, you will be able to land a paid position. That is the objective of how our programs are designed and how we try to operate. Um, Once again, they're going to be designed to fit each individual schedule, which kind of basically means that if a student is able to give the program an hour in the morning, then he's more than welcome to do so. We have some students who are in between jobs at present, so they're able to give the program a lot longer and complete it sooner, right? So the flexibility and the schedule, it plays to each individual student. Um, we emphasize our learning and through the success of our programs with the best career support that we can offer, as well as career support and student support, pardon me, which basically means that students can take advantage of career support, speak to professionals who are, going to be willing to support you each step of the way, give you tips and tricks and techniques that you can start employing, which will help you gain paid positions or clinical externships if that is the program that you went with. And student support would mean that basically any issues and difficulties you face while being a part of the program will be right there with you every step of the way to help and assist whenever that's required. The three key aspects of our programs are basically that it's going to be on demand, which means that our programs can be started from anywhere across the country, started at any specific time. We do have some class start dates for a few programs depending on instructor availability. I'm sure your admission advisors would guide you accordingly. The next is self-paced learning. We have spoken about it, just before this, where we're priding ourselves that we're catering to all different kinds of students. And one-on-one coaching is another thing we pride ourselves in, where a lot of, I would say, education, the facilities in the market right now have a huge number of students per class. We, however, like to do things a little differently, where we like that the student has individual attention from each specific coach, and each coach, as we mentioned previously, comes in with a tremendous amount of experience and with a huge list of students they've already trained. So they really are able to narrow down and give some really good practices to the students, to help them out. Um, some of our partners are going to be mentioned right here. We're affiliated with a lot of different nationally recognized certification bodies, as well as a lot of universities. So it's there for you guys to see. And right, program flexibility is that basically a lot of the programs that we offer are mostly entry level friendly. So this, if this is your first step into the allied healthcare sector, a lot of our programs are going to be a seamless fit for you guys. There are a few intermediate to advanced level certifications we offer, but usually people coming in with little or no experience in the healthcare sector would easily be able to gel in and do the program really well. No relocation is required. So basically, all of our programs, especially the online part of the education, can be done from the comfort of your own living room, wherever you are in the States. It's going to be completely fine. And it's all of the trainings, as we have talked about, are 100% online. The only requirement we would basically be having is for the students to have a basic understanding of computers, of generally operating your Google Chrome, and logging in, logging out, the video formats that we use. So it's just a basic understanding of what we are pretty much already familiar with. And the program, all right, so this is a duplicate, right? Right, here we are with the future of allied healthcare as we see. Just give me one moment. Right. So as of 2025, uh, the roles and the need for allied healthcare professionals is at an all-time high. The future, as I'm sure as a lot of industries are being disrupted by the use of newer and newer technologies and artificial intelligence, which is on the rise. And it's also the same with the healthcare sector, where there are a ton of technologies being integrated every day to all of these different job roles that are in the allied healthcare sector. And the only way to move forward, in our opinion, is basically to start somewhere and build yourself up so that you are current with the relevant certifications, you are current with the relevant fields, and that you can perform at that specific level. To give you a quick example, let's talk about some technology trends. Right now, I'm sure many of you already know that robotic assisted surgery is now a real thing. With the inception of AI getting into this particular field, precision is now a key factor, right? So intraoperative imaging has been added, which basically means that we have a lot more, I would say, um, we've narrowed down a lot of things that in the past we were not able to, in terms of accuracy. And for that particular scenario, we have to be, as allied healthcare professionals, learn those specific tools. Now, some of us might also have heard or be a little bit apprehensive about the fact that AI might replace us, or this technology might reduce the need for humans moving forward. In how I see it, is that it would increase efficiency, productivity, but never eliminate the need for humans and allied healthcare workers in this space. Because a lot of us would definitely still be needing to, operate such machinery, to verify the accuracy of such machinery, and these trends, as well as, and I would say that instead of us helping, I think, let's just say as an example of a medical assistant, now there are AI powered electronic health record systems, which means that the tasks that the medical assistants might be having to do will be lesser in number, but that only increases productivity. When a professional was helping 40 patients, I think in one day he might be able to do so with 70 to 80 people, right? So it's only going to increase efficiency. It's the same with all fields across the board, whether it's pharmacology, whether it's sterile processing, and various others. So the best way to keep yourself aligned is to take a certification, and then upskill yourselves, keep getting more certifications, never settle, and always try to be the most up to date. That is the future of allied healthcare as we see it. Next, we're going to talk about all of our programs. I'm thinking this is probably, going to take a lot of our time. So I'll try to be, as thorough as I can to cover all of the programs. I'm sure the attendees here are already familiar with some information about them, or if they've spoken to their admissions advisors, but we are going to cover each and everything in detail. Let's talk about surgical technologist, which is, I think, one of our star programs, in the sense that a lot of demand for it. this particular year and last year. As with all of our programs, we will talk about the duration, the certification, specific certification you will be prepared for as part of this program, what the tuition options are going to be, what the eligibility criteria is, what in particular are you going to get for the amount of money you're going to pay. So, our offerings, as well as a few restricted states. We'll cover this when we get there. This is something that we all need to pay a little more attention to. So, the duration is a self paced program, meaning you do and you get the flexibility to do the program whenever you need to. But we do have an expectation of the students spending roughly 12 to 15 hours per week on the material. And with that time frame in mind, you should be able to complete the online part of this surgical technologist program within 16 weeks. The certification that you are preparing for as part of the surgical tech program is called the TSC, or Tech in Surgery Certification. It's provided by the NCCT, which is a nationally recognized body. And the full tuition of this particular program is going to be 3450, but there are discounts on offer for the webinar attendees as well as for those people who are willing to pay the program upfront. And we do also offer monthly payment options. We have a multitude of different options we'll cover right at the end, but they are starting from around about $266 a month. So that is something that is an advantage for those students willing to do it with an installment plan. The eligibility is going to be pretty simple, where a high school diploma or GED is the base requirement for you to get into the program, as well as for you to take the official certification exam. Basic internet connection is obviously going to be necessary, along with a mid-tier or decent PC or laptop in order for you to take the program. The offerings as part of this particular program are obviously your self-paced online learning platform. So will we right within this webinar be covering the LMS, basically going over the online platform. But just to give you a brief introduction, it's going to give you a lot of different learning methods. There's going to be your course books, which is going to be online. There's going to be your online video curated library, which are your video lectures that you're going to be taking advantage of. There's always going to be chat support. There's a small student forum right there, along with a lot of other insights and analytical tools. One-on-one coaching sessions are a major part of this program. So whenever you feel that you are bamboozled or you need to have a little more extra help, so we do pride ourselves, as I mentioned, with one-on-one coaching, where all of the industry experts will be able to guide you and answer any potential questions you have about the field or the subject matter, or give you some best practices, mentor you if you speak to them about your particular scenario. Certificate exam preparation is the next thing, which basically means that before taking the exam, you will get a specific exam preparation course along with a few practice exams, which really get you on top of things. They'll let you understand where you're standing, what exactly you need to do better, which areas you need to target more before the final examination. Career support, you'll be getting two career service sessions with the career service representatives, where they will be going over a lot of things with you in order to get your clinical site, as well as paid opportunities. Ebooks we've covered. There's going to be a lot of skill videos as well, before you complete the program to help you out. And the exam voucher for the NCCT is also included in this pricing that we have spoken about. Externship support is something that we will cover a lot in detail after this, but we will also, I would like to at this point tell you that for the Surgical Tech TSC program, basically this is a program which has a clinical component to it, which is a clinical requirement. What that means is, along with your examination, you also need to take 125 surgical cases in order to be fully certified. Now, to break it down once more, for the surgical tech certification, in order to obtain the TSE certification, you need to pass the examination as well as complete the 125 surgical cases. This is more of an intermediate level certification. So whenever a student is coming in with prior experience, getting an externship site becomes a lot more easier for that particular student, especially if they're already working in a hospital, in a clinic. We can recommend them to, places we've worked with in the past, places they have networked with or have, affiliations with, and that would always be, I think, top priority. And with, and we also help the individual student try and find that clinical externship opportunity for themselves. So we train you, we give you those sessions, and we give you the tips and tricks and tools in, how you're supposed to approach different sites in order to find such clinical sites for yourself. What are the do's, don'ts, best practices, and we also will be, going over um, a lot of other key techniques that you would need in order to land that clinical site. There are 4 programs within our list that have a clinical component, this being one of them. Uh, I have, yeah, can it be completed in less than 6 weeks is a question I'm seeing. And yes, absolutely. Since it is a self-paced program, the 16 weeks is the average amount of time we're looking that students are spending on the education. But absolutely, you are able to complete the program a lot sooner. I think we've had a student just last month who completed the program in about a month and a half as well. Because they were particularly able to give it more time, they were highly motivated, and they had set a target in their mind, and there was nothing stopping them, right? And we provided them all the facilities, the tools that they needed in order to succeed. And they're right there, the cusp of it. Yeah, so these are the 2 particular requirements for in order to obtain your certification. Another thing I'd like to mention here is that another possible question I often get during my interview calls with students is that should we go for the examination right after we complete the online part or the 16 weeks, or should we try to find a clinical site, or how does that exactly play in? So my personal recommendation to the students at that point is that complete the course. That way you would get 100% of the theory down. All of the, the learning methods we employ is designed to get you completely prepared. And it is also once you have gone through all of the syllabus, you will have a really good understanding. The next thing you should be doing is trying to find yourself a clinical site. You can start doing that simultaneously because your first career service session can be done while you're part of the program. So you will be able to, I would say, try to find a clinical site, look at our recommendations, look at the list of hospitals we worked with, see if anything's cross-referencing, look at your recommendations, and try to get you a clinical site. Once you are practically applying the theory that you have just learned into the clinical requirements, those 125 surgical cases, you should then go for the examination. That way, you'll have a much better success rate when it comes to passing the exam, and you'll actually, be able to score a lot better. You'll be actually, mastering the material at that time, and should be performing a lot better. So that is usually our recommendation. Um, we now will be moving on to the restricted states. Basically, what restricted states are is that there are some particular certifications for surgical tech and for the other programs that we offer that are valid for some states. However, some state requirements encourage other certifications. So these particular states for surgical tech are not going to be available. For the most up-to-date list, I highly recommend that you get onto our website, and we have a state restrictions page specifically. If one of my team members can put that in the chat so that all of the attendees can check that out. So yeah, that would be really helpful. That would give you the most up to date. There are some states on the website which are going to be marked green, which is that you can absolutely take that program in that particular state, and there are no state restrictions or requirements. The second thing is going to be the yellow marked states, which have some additional requirements. So you might be able to take the certification, but there might be some state, bodies which require you to be affiliated or get registered in a couple of other places in some scenarios. But obviously, you need to ask your admission advisors, pardon me, about each individual state and program, and they'd be able to guide you accordingly. Some red states would basically mean that that program cannot be given in that particular state. You could still be part of the program, gain all of the knowledge, and my recommendation, if you do decide to do that for a yellow or red state and do decide to go with one of our programs, speak to the employers or the hospitals around you. before. Look at the requirements that they have. If they're willing to accept, let's say, the TSC, then by all means you should go for it. But if there's apprehension, if there is a slight a doubt in your mind, then definitely you might want to look for one of the other programs that we offer at Health Tech Academy. The syllabus can be downloaded on the website as well. So you can definitely go ahead and go to the page. And for each specific program, we have a separate page where you can download the website, download the syllabus and learn a little bit more about that. Let's talk now about the medical assistant program. The medical assistant program is also roughly for 16 weeks. Same policy applies where you can complete it sooner or later, depending on the time that you're giving to the program. But the rough estimate that we like to give to the students and the usual average that we see is 16 weeks. The certification you are preparing for is called the Certified Clinical Medical Assistant, or CCMA for short, by the NHA, the National Health Career Association. Now, for this particular certification, we have split this up into two due to the requirements of a lot of the students. We do offer this program at 1250, which is a lot more affordable than some of the other programs. And after the webinar, obviously, you can talk to the admission advisors about the discounts we have on offer. The upfront discounts that we have are also always going to be available. The prices on the payment plans start at $49 per week. They can also be done on a monthly format. Whatever suits the student, we usually are very flexible when it comes to that payment option. So you can ask your advisors about that. The eligibility is going to be the same, where you need a stable internet connection and just have your high school diploma or GED. The offerings for the 1250 medical assistant program is that the online platform, which is going to cover all of the learning methods we spoke about, will be provided. There will be career service sessions, your skill videos are added, and your textbook online, your ebooks will be provided. With the 1250, the exam voucher, the exam preparation course, and the 5 live instructor mandatory sessions are not added. This was done specifically because we had a lot of students who were wanting to do the program without that. But if a student is coming in with little or no experience, I highly recommend that they join the program with an all-inclusive package that we have that is for $2,000 in its entirety. Also, upfront discounts available for that, which is also going to include the 5 live instructor sessions, the exam voucher, as well as the certificate preparation course, which gives you a lot of practice exams. There are some restricted states for this, but obviously for the most up-to-date information, check out the website page, the compliance page that we have shared in the chat right here. The syllabus obviously can be downloaded once again from the website. And the next program we're going to cover is the Patient Care Technician, or the CPCT, also by the NHA. It's also a 16-week long course. This is the certification you are preparing for. Just like the medical assistant program, the CPCT has no clinical requirement, which what that basically means is after getting your education through us and after passing the certification exam, you can directly be eligible to apply for different jobs. You will be fully certified and can definitely, with the help of our career services, look for paid opportunities for yourself. The full tuition for the patient care technician program is going to be $34.50. The payment starting from $266, and the discounts for webinar attendees and upfront payment students is going to be available uh, for each and every one of you. Eligibility is the same. The offerings are going to be the same as for surgical tech, which basically are the online learning platform, the one-on-one career coaching sessions, the certificate exam preparation course, the exam voucher added, some skill videos, your textbooks, career support, everything is added. Here are the 3 restricted states that we've added, but obviously, once again, you know the drill. Go to the official website and check out the compliance page. Syllabus can be downloaded once again through the website. Uh, for the next program, we have Pharmacy Technician. Now, this is a program that we kind of have 2 separate programs for Pharmacy Technician. One is called the Pharmacy Technician and one is called the Pharmacy Technician Professional. You might be wondering what is going to be the difference between the two. The simple answer to that is there isn't a lot of difference. The offerings are basically the same. The price point is going to be the same. The Pharmacy Technician program is offered through the NHA's certification, which is called the CPHT, and whereas the pharmacy technician professional is offered by the PTCB, which is a separate or different certifying body. It's also nationally recognized, but yes, it's a separate certification. The next question that we get with a lot of students applying for this program is that which should we be actually going with, right? And the answer to that is you need to do a little bit of research depending on your specific location. In some locations, in some locale, um, the PTCB's certification is more favored, and in some areas, the NHA. Affiliation and ties are stronger, and their specific certification is more sought after. So, and it also would depend on the restricted states. The restricted states for each are some might be overlapping, but most of them are different. So, based on where your location is, I would recommend going for that specific program. For both of these programs, there is no clinical component. The offerings are the same. It's going to be 16 weeks long, but self-paced. And the full tuition is the 3450 bracket of programs that we have, the same eligibility and similar offerings. Now, the next program I'd like to focus on is the dental assistant. The dental assistant, we have noticed in the recent past, is that right after taking the course, students are having a lot of success landing paid opportunities right after they're completing the program, which is, this isn't a professional opinion. This is just something I've observed, which I decided to share with all of you. So that's something you take it with a grain of salt. But yes, 16 weeks long. The certification is the RDA, or Registered Dental Assistant, by the AMT. Full tuition is in the 3450 bracket, same eligibilities, same offerings as the other programs. And for the restricted states, you will definitely want to check out the compliance page. Now, we're going to take a 10-second breather, and we'll also look at some of the questions you might have been asking while I have a sip of water. Right. So one of the questions we've had is, are exams offered in each and every state, or there are specific locations? So for each specific examination body, let's say for the sterile processing program, the HSPA has a lot of testing centers throughout the country. And for each of these certifications, for most of these certifications, they offer an online examination feature as well. My personal recommendation to you is that if you have a testing site which is close to your location, always go for a physical examination. The reason is because it's going to be a lot less stressful. For the particular online exams, you will have a lot of, I think they use software which tracks where your mouse is going to be. You can't be changing tabs. You can't be, looking around here and there. It has to be really, it's quite strict. Otherwise, you do get disqualified. So it's a little more stressful than I think it needs to be, which is why I always recommend going physically to the testing centers if it's in your location. If it's obviously a little further away and it's not making sense to you, then obviously go for the online examination as well. Uh, right. Just one more moment while we. Right. Thank you. So for the sterile processing program, the certification is called the CRCST. This is the second program in our roster which comes with clinical requirements. So along with completing the CRCST exam, you also have to have 400 hours of clinicals under your belt in order to be fully certified. The same rules apply as did for surgical tech, where I recommend that you take the online course, get your theory down 100%, try to find a clinical externship site with the help of our career support representatives, and then once you are well versed and have practically applied the skills, go for the examination. It is again 16 weeks long. The 3450 bracket applies here as well. The same eligibility, the offerings are going to be the same, with the key exception being that the externship support requires 400 hours instead of 125 surgical cases. Let me put that into actual, terms for you, where it might be a little more, where you might be able to, plan that out accordingly. 16 weeks if you are spending on the education, which is roughly 4 months. You should add in another month and a half to two to find a clinical site. We do start the process early, but it can take anywhere between 90 days to 180. Pardon me, not 180, but roughly around 3 months sometimes for some students, depending on their location, to find a clinical site. So if we add that to 4 months, we can add that roughly to 7 months. The externship, the 400 hours, take another, I would say, 3 to 4 months to accomplish. Sometimes 2 months in some cases, but obviously for the more for this particular purpose, we'll take in 4 months. That is roughly going to give you an estimate of 11 months. Take the certification exam and getting certified, roughly an year for you to get fully operational and functional with your certification. And then finding a job can also take a little longer. So yes, 1 to 1.5 year is a realistic timeline that you should have in mind for sterile processing. Similar for surgical tech as well. While we do mention that 16 weeks is all it takes, the 16 weeks, I would like to reiterate, is the online part of the program. For programs such as dental assistant and our other programs, you can get certified right after this, as we've talked about. So the time to land a paid position is a lot less. But for those programs who have a clinical component to it, finding that clinical component, completing those hours, then trying to get a job, it does take a little bit longer. So do keep that in mind when applying and starting such a career. Um, Right. No particular state restrictions for sterile processing, but do again check the website and download the syllabus if this is the one you want to go with. Um, let's talk about the phlebotomy technician. Phlebotomy technician is the third program which does have a clinical component, but this is one of our shorter courses. It only roughly is going to take 12 weeks to accomplish, which is a lot less than the 16 weeks. It's roughly 3 months. The certification you will be appearing for as part of this program is called the CPT, or the certified phlebotomy technician, also by the NHA. The total course cost is $2,000. Discounts are on offer. Same eligibility. The offerings are going to be the same, with obviously the key exception being of the externship support, the externship requirements being that it's going to have, it's going to have, I believe there are some cases that you need to do as a phlebotomy technician, a couple of capillary sticks that you need to perform. So all in all, the clinical component is roughly a month and a half, if I remember correctly. And yes, there are a few restricted states as well over there. And yeah, we'll move on over now to our medical coding program and medical coding and billing program. Basically, they can, they're very similar programs where the CBCS is going to more by the NHA is going to prepare you more for the billing roles rather than the coding roles. The coding roles usually come after a little bit of experience. So if you're just starting off, I would highly recommend doing the medical billing and coding and trying to secure the job role with a more billing side on the more billing side of things. It's a 12-week long course, so it's not one of the most lengthy courses we have. The full tuition is, however, going to be the 3450 bracket, and the reason for that is that the offerings are going to be a little more extensive. We are going to be providing you a few hard copy, material as well with this, which is why the tuition is as it is. There are no straight restrictions, but do check the website. But for and yes, of the medical coding for the more intermediate to advanced level certification is going to be with the AAPC, and this is going to prepare you for, I would believe, the more advanced level certifications, 14 weeks roughly. And the full tuition for this, I believe, is also 3450. This is probably a typo. We'll get that corrected, with payment plans starting from 266 a month. Obviously, for all of the programs we have, you can pay weekly or fortnightly, which is bi-weekly, depending on what suits you and what you're comfortable doing. But obviously, speak to your admission advisor regarding that. No straight restrictions in this particular program. Healthcare IT is basically a program that we have that is going to cover multiple certifications. So the CEHRS by the NHA, as well as the CompTIA IA by the ITF Plus by the CompTIA IA, is going to be added in this program. The healthcare IT is a very interesting program because it not only is preparing you for the healthcare IT role, but there are some entry level or basic courses related to, I would say, product management, to a lot of leadership skills are taught in this particular program. So this is one of those programs that we really pride ourselves in, and is definitely helpful. And with this particular program, you do get both of these exam vouchers added into the cost, and the cost is a slightly higher because you are obviously going with two separate certifications, and the material is going to be covering a lot of these specific materials. Same offerings as the rest of the programs, as well as a few straight restrictions. Do check that out on the website. Now, as you can see, the medical health record specialist, the CHRS, is going to be the same certification as you're going for the healthcare IT, and you might be wondering why. Uh, that's because if you for the entry level positions, it's usually just a record specialist position which they can obtain through the CHRS. But if they're going for a complete IT mastery within the allied healthcare sector, then definitely that is something that this is the program that you would want to go with. Or if you're already in the field, this is the upskilling certification. And there are after this also further certifications that you can do to even get further better positions. But yes, a 12-week long course for the CHRS, and this is at one of the lower price points, the more affordable options, with $2,000 being the full tuition with discounts available, and 141 to start off with on a monthly basis. We will be covering EKG, and this is our final program with a clinical requirement. However, the clinical requirement for the EKG program is very, very small. I believe you just need to do 10 EKGs on a live patient to actually do the requirement for the clinical requirement for your certification. The certification is called the CET, or Certified Electrocardiogram Technician, by the NHA once more. And it's an 8-week long course. I think this is the shortest course we offer on the program, on our platform, pardon me, and with a $2,000 price bracket, 141 monthly payments starting, discounts on offer, all the same offerings. Lastly, we'll quickly cover the healthcare leadership program. There's no official affiliated certification we're giving, but we're providing our own health tech academy certification, which we're very proud of. This leadership program is basically designed for any individual in any of these fields who's looking to upskill themselves, get into a management position, or become an incredible team member. Because obviously, leadership skills are something that not only management should be well aware of, but if you're looking to become an essential cog in the system, in being part of that team, this is something that is going to help you out tremendously. There are no restricted states for this particular program because this is in-house and the certificate is in-house. The eligibility we have kept is similar as to you having a high school diploma at the very least, along with a stable internet connection. This is priced at the 4,000 or the 3950 bracket, but you can speak to your advisors about the discounts. We've already covered this, and that brings us to the end of the programs. We'll quickly take a tour and a demo. We are slightly above time, I am noticing, but I will try to, be as detailed and as quick as I can. And we'll quickly take a tour of the online platform right now. So the login information I have is basically a test account we have created. So this is going to be, okay, I think I need to refresh it. Just give me one moment. Yeah, so this is a test account we have created, which is going to give you, I would say, an understanding of how the platform is working, what we're offering in that particular platform. So let's quickly dive into it. As you can see on your left, you'll be seeing this tab where you'll be going over, for this particular account, we have multiple boot camps, but for you, probably there would just be one or two, the ones that you've purchased. Your coaching sessions, your particular profile will be right there. Analytics of how much time you're spending and what you're doing on the program will be right there. The progress reports as to how you're progressing along, and obviously the documents related to your admissions and related to that will be available here as well. Let's quickly take a look. Yeah, the analytics, some of the analytics will be right here on top as well. Let's quickly go over, for this example, to our surgical tech program. This pop-up will keep on popping up until you complete your profile, but obviously for now, I'll be doing this later. This is going to be asking you for some basic information, which I think on any platform you would need to put in. Um, Now, for this particular program, you can see there are going to be a couple of duplicates, but this is where all of your courses are going to be. And right there on top, we have the certification page. So after completing each particular course, you do get a certificate which you can download and use accordingly if you need to. A couple of more analytics right here. And this particular area is going to give you some really important job data, which basically means that for every particular state is going to give you a general understanding. So let's, for this example, take in surgical technology, since that's what that we're at. And let's take in the state of Michigan as an example, and a beginner level, which I think most of us will be starting off with, a more beginner to intermediate level. So that's what you put in. And this is going to give you some real live statistics as to the average salary of surgical techs in Michigan, uh, exact job openings right now through the NLX and BLS and Indeed, what the career outlook says, and what is the the job rate is. If you actually click here, it's going to take you to the NLX website and be able to give you those job openings. So this is one of, I would say, a really important feature where students can, in real life, look at what they're basically getting into and what the job roles are currently today in the market. And they can obviously start exploring, applying, and doing their due diligence regarding that. Right. Moving forward, let's click on, let's say, the introductory course, where you would be able to, you see the red button right beside that was also the download button for your certification. So if this test account had completed this particular course, they would have been able to get that certification. So let's start with the introduction. And then obviously the introduction would, you would get to meet all of your instructors right here. They give you a brief overview of the uh, the Health Tech Academy, as we've kind of given you today as well. One important thing I would like to point out that is all of these courses that we have, there are linear in in methodology, which basically means that you cannot skip over to the next course. You have to go over them linearly. Go over all of these lessons, go over all of these videos and other resources that we provide, and after which you will have to take an onboarding survey. Onboarding right now is just going to be for the first course, since this is the first one. There's going to be a course exam and a course survey after each particular course, this being the outline and your contents right here. Right here is a discussion forum where students can post in inquiries, questions, and basically all of the other students will also be able to partake, meaning this is your student forum where you can connect, help out, motivate, cross question, form study groups, whatever you guys need to do. Right over here, I also recommend you enter the theater mode, which is, I think, a lot more easier to navigate the particular video. The learning assistant we have is our AI assisted, or artificial intelligence integrated or embedded into our platform, which basically means that any questions you have about the program, you type it in right here and you'll get an instant response. It's one of my favorite features right now as part of the LMS, and we're getting a lot of positive reviews about this. Coaches can be looked upon here. Now, for this particular account, we have used 4 sessions as an example, and one is remaining. These are going to be all of your coaches that you can book a session with. Let's take a quick example of Lawada, who is one of our really professional and really experienced coaches. There's going to be a profile with her, right? Her profile is going to be right here, and obviously you can book a session which will take which will take you to her calendar page, and you will be able to go over all of her uh, available slots for the remainder of the month if you choose to book a session with her as part of one of your sessions. All right, so as we can see, she has some dates available in this, and I think then she's going to be going on leaves, but we do have other instructors to take her place. um, Now, it goes without saying that 5 sessions mean that if you can book them with each individual instructor, but I usually recommend the students to read all of the profiles, do their due diligence, and either stick to 1 or 2 instructors, so that way they have a background of what, or what you're coming into with your questions, and they'll be able to guide you accordingly. And obviously your transcript, being whatever is being said and recorded in the video, can be also read right here on the side. Mm, yeah, and basically that is going to be it for our platform. Let's quickly move on back to our presentation. I'm sure you guys can see this once more. And yeah, let's move on over after this. The admissions process is going to be very simple and straightforward. You after this webinar can also speak to us directly, or you can definitely, go to the website, put in a request form, and one of the advisors, such as myself, would be reaching back out to you momentarily. The admissions process is very simple. They'll be going over the details of the programs with you. They'll be talking to you about the eligibility, the requirements, and if everything is in order, you are highly recommended to start as soon as possible. Choose your payment options, and once you've paid your enrollment fee or decided upon your deferred payment methods, you can move on forward with the course. The financing options are that we always offer discounts to people who are willing to pay the program in full before they start. Up to 30% discounts are available for various programs. And for this discount webinar, we will be offering some exclusives as well. There are monthly options available, such as through financing partners such as Ascent, Fortify, Edley, Sally May. We also offer a study now, pay later option with a firm, and we also offer a in-house interest-free option available if that is the one you want to go with for all of the programs. Now, the career services is something that we have spoken briefly about earlier in the webinar, but I would like to reiterate a couple of points where uh, basically our job at Health Tech Academy is to guide, motivate, and assist the student in finding a clinical site or paid opportunity. We are not going to promise, especially with an online program such as ours, with the certification preparation that we provide, that we guarantee you a paid position after you complete the program. There are some people in the market who do this, and it's not a really good practice to have because it is extremely difficult. There are a lot of moving parts. It depends on case to case, state to state, student to student, and as I mentioned, a ton of different things. But what we do promise and what we do pride ourselves in is that we are able to not hand you the fish, but teach you how to catch your first fish, give you all of the methodologies, train you, with the best practices, the do's and don'ts. There are LinkedIn sessions with connections being the primary method of finding externships and paid opportunities, resume writing when it comes to, getting better visibility. And then obviously, whenever you do land an interview preparations are also going to be part of the program. So catching your first fish is what we pride ourselves in, is what we will teach you to be doing. Tying into that, the career resources and support that we provide is that all of the career services sessions are one-on-one. They are personalized to your specific needs. So if you're coming in with experience, if you're coming in from a different background, if you are in a particular state where there are restrictions, each of those sessions will take all of those specific details into account before actually providing you some advice. Many tools, whether it's hard or soft copies, are provided to you, and we've covered all of these just momentarily. And interview preparations and practice is also given to you. Career support as well as student support, which basically means student check-ins from time to time, making sure that the student is on track. If we feel that you are like, obviously the program is self-paced and it does give you flexibility, but you do have the option to, I would say, we do keep a track of all of the students, connect with you on a regular basis, and make sure you're doing well within the platform as well as by yourselves. Some student testimonials I'll take a moment for you guys to read while I have just a bit of water. You can be asking your admission advisors for more of these Trustpilot reviews. We will also be sharing that link with you where you can go onto Trustpilot, which is a completely transparent website, unadulterated, and you can check out what students, graduates have been saying about us. I'm sure you'll be pleasantly surprised. Uh, some video testimonials are also on our YouTube channel. If one of my team members can add that link to the chat, or you can also ask your particular admission advisors for that. That would be most helpful because we are a little short on time. I'm not going to be playing any of these videos, but definitely we do have a lot of student testimonials and a lot of people who have taken the program with a really good satisfaction rate. So you can definitely check those videos out on our YouTube channel as well. That brings us to conclude our webinar. We will be taking Q&As, but right before then, I will also announce something that you all have been waiting for, which is our special webinar discount. Basically, for all of you who have stayed with me to the very end, I do see that most of you, I think just a few of you decided to leave, but yes, most of you have stayed with me, so I do thank you for that. The discount that we're offering is a flat 30% off for the students who are taking the surgical tech program, or the programs priced at 3450. So it's just going to be a 2400 the complete package with 2400 with all of your programs for 3450, and we're also adding a free laptop on top of that as part of a special webinar discount. For the medical assistant program, for the 1250 package right now, we're offering a flat $250 off, and the entire program is going to be priced at $1,000. And we're also adding a free laptop for our students as a special discount on top of that. I'll leave the screen here for 2 minutes so you can, use these QR codes if you want to visit the website. You can speak to admissions directly through this number right here. Go to the website and, put in the form to speak to them, or just scan the QR code. And if you are unsure as to which particular program is the best fit for you, or if you are contemplating different programs, you might want to take this career assessment quiz, which will ask you a couple of questions and then I think give you some best results that might be a good fit for you. So now let's move back up to our Q&A section. Any particular questions you have, please write it into the chat support and the Q&A section. I will be going over most of them right now. So one of the students has asked if we have a specific list of hospitals for each city and state for clinicals. Yes, we do have that list. The admissions advisors will be able, the admission advisors, pardon me, will be able to share that with you on request. But I would again like to reiterate at this point that since we're providing this program across the country, we do have around 80 to 90 different affiliated hospitals, but not all of the students can be affiliated, or pardon me, get facilitated at one of those facilities, because obviously there is a matter of availability, there is a matter of your particular skill level, and there are again a lot of moving parts that go into you getting a clinical site. But what I did mention was that we do promise to find or train you on how you yourself can find a clinical opportunity within your area. Our career service representatives will also take out a list of those hospitals, call on your behalf, email on your behalf, form the affiliation. So the eventual accreditation affiliation definitely needs to be done between institute, that is us, and hospital. But yes, the more you are able to facilitate, the faster your process will be, and the quicker you will be able to land a clinical site and eventually a paid position. So you are the pilot here, and you will be driving your own destiny. Another question we have, one of the questions on the chats, let's go right. Do we get as many meetings as we want, or is it limited? Yes, we do offer 5 coaching sessions as part of our programs within those packages that we have spoken about. But just in case that you need to speak to the instructor once more, or if you need an additional session, that can be arranged at a very slight cost. But yes, the 5 live instructor sessions are added at the same pricings that we have spoken about. The pricings that we have spoken about have no hidden charges, no extra fees, or any of that sort. It's going to be all inclusive within that pricing, all of the offerings, all that we spoke about, including your enrollment fees. So that's something to take note of. One of the students has asked for a particular state, so obviously speak to your admission advisors once again about that particular state. And if you want to talk about the compliances, then obviously we have the website for you as well. Does the promo code expire? Do you have to pay in full to use the promo code? Yes, we do. The promo codes are for those particular students who are going to be paying the program in full, and this discount, the substantial 30%, are going to be for those students who are paying in full. If you, however, do want to speak to the admission advisors about discounts related to the monthly payment options, then definitely by all means do so. From time to time, we do offer some sort of discounts on that as well, on the monthly fees. What if you want to finance the course at a discounted rate with the free laptop? Do we still get the deal? Uh, for the free laptop, that is the webinar exclusive deal we have going on right now, which is for the um, full payment option. Another student has asked about one particular hospital, then obviously you will need to speak to your admission advisors regarding that. And that is the end of our questions. I think I've covered everything. Just in case I may have forgotten. Yeah, there's one more question I see, which is how long is this offer valid for? And it is going to be valid for until one more week. So by the end of next Friday, I think we can stretch it along till that range. We will be able to, give you this particular discount. How much is the fee for those coaching sessions? I believe the fee for the coaching sessions after the 5 coaching sessions is going to be $100 per coaching session, but I will. You can speak to your admission advisors about that for the most accurate amount. There is one more important question I see. We are on time, but I feel that we might cross a little bit. One student has asked about our affiliations. I feel that this is an important particular point to cover, which is why I am letting this go slightly over time. And that way we can answer this very last important question. Now, traditional colleges basically offer accredited courses in like BAs and MBAs. Health Tech Academy focuses on certification preparation courses. These are short courses. There are industry recognized certifications that get you ready for the job role, but these are short courses. So we're not traditionally a college and affiliated in those terms, but all of these certifications that we are offering, they are affiliated and recognized and accredited nationally by those specific examination bodies, such as the NHA, the National Health Career Association. In terms of surgical technology, we are affiliated with the NCCT, the National Center for Competency Testing. And so all of these particular bodies are affiliated with the NCCA, which is the National Commission of Certifying Agencies. So the flexible structure that we're providing, along with the very, very affordable price points and the industry recognized certifications that lead to those particular job roles, is what our job and what we actually take pride in. So I hope that answered the question. I thank you all so much for being here with me, for sticking with me till the very end, and best of luck to each and every one of you. If you have any remaining questions, please do connect with our um, mm, uh, admissions advisors. Best of luck with your allied healthcare journeys with Health Tech Academy and beyond. Thank you. Goodbye.